So how can we be attentive to signs and symptoms that can indicate patients who are progressing or patients who are likely to progress? So a couple of different things, patients that develop more lesions, right? When there is an increase in the amount of the body surface that is involved by the disease, the appearance of thicker lesions, right? We have a patient who has stable patch disease and now is developing plaques, or of course, if the patient develops tumors, the appearance of the lesions after remission, the presence of generalized erythroderma, and of course, patients that have signs of extracutaneous disease. If we had a patient that suddenly develops lymphadenopathy, organomegaly, but it's important to you to remember that not all patients that have swollen lymph nodes, it means that they have disease in the lymph nodes, because we know that the presence of a rash clinically and the presence of inflammation in the skin is going to activate the lymph node. It's going to enlarge the lymph nodes and can give you a process called dermatopathic lymphadenopathy. So it's important to study those patients further. Of course, the presence of aberrant lymphocytes in the peripheral blood. It's important to remember that the traditional way we used to evaluate for those was by a morphologic assessment. And I think some people might remember the use of the so-called Caesary cell counts. And those turn out to be actually not a very good reproducible way for evaluating the malignant cells, because we know that atypical cells can be present in reactive conditions and do not necessarily mean malignant cells. So changes in skin symptoms, patients that suddenly develops worsening pruritus, patients that develop recurrent infections, and et cetera. And one thing that is critical from this slide that I think it's important to remember, that it's 1 in every 3 patients with MF will at some point develop progression of the disease within the skin or to other compartments that would include the peripheral blood.